Good evening to you, Professor. Thank you very much for joining us. Thank you for your time. We have bought some time. 80,000 tests, I think, is what NICD says have been processed so far. How many do we need to have done to get a real picture of what COVID-19 is doing in South Africa?
Okay, so good evening to you. And so I think the reality is that we really need to base what we should be doing based on the best case example in terms of a country which was able to contain the epidemic at a relatively early stage, and that is South Korea. And in South Korea, what they did over a period of about 2 to 3 weeks, they were testing roughly about one person for every 150 of the population. So the figure that you just heard mentioned by the Minister of Health about targeting testing at least 600,000 people, that testing of 600,000 people should be taking place over a period of about 3 to 4 weeks. And that will roughly translate into one person being tested for every 100 people in the population. So as a sort of broad measure, that's what we're really targeting, testing at least 1% of the population in the period of the next 3 to 4 weeks. It can't be spent out over 4 to 5 months, because doing so will effectively diminish the ability to basically respond to the epidemic at a point in time. So what we really need to be targeting is probably testing roughly about 17 to 20,000 individuals each day in South Africa for the next 2 to 3 weeks.
Now, we are nowhere near that, because at the moment we've done about 80,000 tests. That's probably in the last 3 to 4 weeks. There's no way, surely, that in the next 2 weeks we're going to do another 520,000 tests to get us to that 600,000 tests, to give us an idea of exactly what's happening with this virus.
Correct. So I think there's been some positive movements over the period of the last 3 or 4 days. And in particular, the mobilization of healthcare workers to do door-to-door screening for symptomatic individuals and for those people to come forward. And that is already somewhat reflecting in terms of the number of tests that are being done. So as an example, before the lockdown, we were roughly doing about 1,000 tests per day. I think over the weekend, I think it was on Saturday, where they did 3,500 tests on Saturday alone. And what's materializing now is that by doing more tests, we're already seeing an increase in terms of the number of cases being reported day on day. So day before yesterday, there were about 75 additional cases. Yesterday, I think there were 150 additional cases. So with the ramping up of the community workers going into households to identify individuals that are symptomatic, we're going to be increasing the number of tests that are done. But like I said, 3,500 is still a far way off from our target of 15 to 20,000 per day. But if we don't do this, we're really not going to benefit from what has happened over the past 3 weeks and what's going to happen 2 weeks moving forward. That is the lockdown period. Because the main purpose of this lockdown was really to identify infectious cases, to put them into isolation, and to trace their contacts in a much more contained manner, and put those contacts under quarantine. In the absence of doing that during this lockdown period, for all intents and purposes, very little will have been gained with this lockdown. So we don't have a choice but to ensure that we scale up the testing down to about 15 to 20,000 each day over the period of the next 2 to 3 days, literally.
But it certainly sounds like we're not going to reach that target of getting that right amount to get a real handle. Also, how much are we hampered by backlogs in processing the tests and actually getting enough test kits to use? Because we know the whole world wants these kits.
So, Yeah, that's a real problem, and it really speaks to an issue in terms of how well our laboratories have been prepared to be able to do testing at scale right at this point in time. So while the capabilities might exist in South Africa, I'm not too sure of the capacity. As the Minister pointed out, there is a global shortage of these test kits. It's not unique to South Africa. But what we need to do is to see what sort of resources we can mobilize to ensure testing at scale. Unfortunately, we're in a difficult situation. We're competing with the rest of the world for scarce resources when it comes to the kits that are required. But we need to use all the platforms that are available to us. We need to use all the resources that are available to us to actually scale up the testing. Right now, the focus of just doing testing in the private sector and at the NHLS probably undermines our true ability to test at scale. And what I'm really referring to is a number of higher education institutions that have got laboratories that can be repurposed to actually assist government in terms of testing to scale. And that resource needs to be mobilized as well in an immediate period.
So essentially what you're saying is every single laboratory, public, private, university, wherever it is, needs to be processing these tests because we're in a race against time.
Exactly. Wherever that capability exists, they need to be mobilized. And I think another important aspect of testing is not just the number of tests you're doing. It's a number of tests that you're doing that you can turn around a result within a 12 to 24-hour period. Waiting for results to come back 3 to 5 days after the test has actually been done is a completely fruitless exercise, because during that period of time, that infected individual will have gone on to infect other individuals, hence sort of having a domino effect in terms of future testing.
Prof, we are
required and future cases that would need to go into isolation. So it's not just it's how quick we get those results back to those individuals.
Prof, I do have to ask you, a lot of people are saying, when is the virus going to get really bad here? We're seeing devastating stories around the world. When do you predict the virus will hit us its hardest? Do you think mid-May is our danger period, or is it impossible to say?
It's basically dampen the community transmission of the virus, and it's probably delayed when we can expect the peak period of circulation. The peak period of circulation will most likely come after the lockdown has been lifted. And that's not because the lockdown didn't work, but it's simply a matter of there being more community transmission once the lockdown has actually been lifted. So the projections currently, including by the Department of Health, from what I understand, is that they're expecting a peak period around about August. It might be sooner.
Thank you so much for your time. I really do appreciate it. That was Professor Dr. Shabir Mahdi, epidemiologist and vaccinologist at the University of the Witwatersrand, just giving us a scale and an idea of how much work has to be done to process as many tests as possible, and also telling us that current predictions are that the virus will hit us hardest, likely sometime in August.